Hi, I'm Dr. Brian McDonough. The question is, how is the COVID vaccine going to be distributed as we get past the phase with healthcare workers and those in senior settings? Well, the goal is to essentially repeat the experience of getting the flu shot. State health departments are finalizing plans, and they're going to change, but hospitals and large pharmacy chains, such as CVS, Walgreens, they're expected to be among those administering the early vaccines. By late spring and summer, independent pharmacies, local health clinics, doctors' offices also should be administering the vaccine as well. And don't be surprised to see creative distribution paths such as outdoor and drive through clinics. That'll allow for large numbers of people to get the vaccine in the safest and shortest manner possible. Now, one major reminder, whether vaccinated or not, we all need to continue wearing masks and social distancing. Now, what about healthcare workers? Some of them have already gotten them. So, what's the situation there? Well, if you really think about it, there's been empty chairs at holiday tables, skyrocketing numbers of COVID cases and deaths, and the odd politicization of a virus that doesn't have an ideology. So, COVID 19 has taken a toll on everybody. But when you look at healthcare workers, it's kind of a unique group in a sense because they have to meet the challenge, like so many Americans do on a daily basis. But the reality of caring for patients when they're all alone in hospital beds without family present, that takes an emotional toll. Now, I will tell you, healthcare workers, they've cried in private, yet they only return to the battlefield. And it's been bleak, even with the occasional smile. It's covered by an N95 mask, it's smothered by a face shield. So the vaccines being distributed is essentially a godsend. With every prick of a needle in an arm, there's almost an injection of hope. And there's a knowledge that there is an end in sight in the battle. Now, we know there's months to go, but the thought is that all these tears of sorrow are going to be tears of joy, and those who need to deserve to see their family members when they're sick, and family members who want to have families there will have them there. You know, Healthcare workers won't have to replace family. They're going to be part of the treatment team, which is what they're designed to do. And I believe they're going to feel better and better about being able to treat people and often having an excellent result. It's been very depressing. It's taken a toll on all of us, but at the same time, we're going to get through this, and we just got to get through it together.